Welcome to my channel Health for You. Treatments of infertility for men. This will depend on how many factors, including the age of the patients, how long they have been infertile, personal preferences, and their general state of health. Even if the woman has causes that cannot be corrected, she may still become pregnant. Frequency of intercourse. The couple may advise to have sexual intercourse more often. Sex 2 to 3 times per week may improve fertility if the frequency was less than this. Some fertility experts warn that too frequent sex can lower the quality and concentration of sperm. Male sperm can survive inside the female for up to 72 hours, while an egg can be fertilized for up to 24 hours after ovulation. Fertility treatments for men. Erectile dysfunction or premature ejaculation. Medication or behavioral approaches can help men with general sexual problems, resulting in possibly improved fertility. Varicocele. If there is a varicose vein in the scrotum, it can be surgically removed. Blockage of the ejaculatory duct. Sperm can be extracted directly from the testicles and injected into an egg in the laboratory. Retrograde ejaculation. Sperm can be taken directly from the bladder and injected into an egg in the laboratory. Surgery for epididymal blockage. If the epididymis is blocked, it can be surgically repaired. The epididymis is a coil-like structure in the testicles which helps store and transport sperm. If the epididymis is blocked, sperm may not be ejaculated properly. Semen fertility treatments for women. Ovulation disorders. If the woman has an ovulation disorder, she will probably be prescribed fertility drugs with regulate or induce ovulation. These include clomiphene, Clomid, Serofine. This medication helps encourage ovulation in females who do not ovulate regularly or who do not ovulate at all because of polycystic ovary syndrome or some other disorder. It makes the pituitary gland release more follicle stimulating hormone and luteinizing hormone. Metformin glucophage. Women who have not responding to clomiphene may have to take this medication. It is especially effective for women with PCOS, especially when linked to insulin resistance. Human menopausal gonadotropin or HMG Repronex. This medication contains both FSH and LH. It is an injection and is used for patients who don't ovulate on their own because of a fault in their pituitary gland. Follicle stimulating hormone gonal-F Barville. This is a hormone produced by the pituitary gland that controls estrogen production by the ovaries. It stimulates the ovaries to mature egg follicles. Human chronic gonadotropin Ovidrel Pregnyl. This medication is used together with colimifene, HMG and FSH. It stimulates the follicle to ovulate. Gonadotropin releasing hormone analogs for women who ovulate prematurely before the lead follicle is mature enough during HMG treatment. This medication delivers a constant supply of GnRH to the pituitary gland, which alters the production of hormone, allowing the doctor to induce follicle growth with FSH. Bromocriptine Parlodel. This drug inhibits prolactin production. Prolactin stimulates milk production in breastfeeding mothers. If non-pregnant, non-breastfeeding women have high levels of prolactin, they may have irregular ovulation cycles and have fertility problems. Risk of multiple pregnancies, fertility treatments. Injectable fertility drugs can sometimes be the victims of their own success and cause multiple births. When the woman gets pregnant, she has twins, triplets, or perhaps more babies in one go. Oral fertility drugs also raise the risk of multiple pregnancies, but much less so than injectable ones. It is important to monitor the patient carefully during treatment and pregnancy. The more babies the mother carries inside her, the higher is her risk for premature labor. If a woman needs an HCG injection to activate ovulation and ultrasound scans show that too many follicles have developed, it is possible to withhold the HCG injection. Couples may decide to go ahead regardless if the desire to become pregnant is very strong. Multifetal pregnancy reduction is possible if too many babies are conceived. One or more of the fetuses is removed. Couples will have to consider the ethical and emotional aspects of this procedure. Surgical procedures for women. Fallopian tube surgery. If the fallopian tubes are blocked or scarred, surgery may repair them, making it easier for eggs to pass through them. Laparoscopic surgery. A small incision is made in the woman's abdomen. A thin, flexible microscope with a light at the end, laparoscope, is inserted through the incision. The doctor can then look at internal organs, take samples, and perform small operations. For women with endometriosis, laparoscopy removes implants and scar tissue, reducing pain and often adding fertility. Welcome to my channel, Health for You. Assisted conception, IUI and IVF. The following methods are currently available for assisted conception. IUI, intrauterine insemination. A fine catheter is inserted through the cervix into the uterus to place a sperm sample directly into the uterus. The sperm is washed in a fluid and the best specimens are selected. This procedure must be done when ovulation occurs. The woman may be given a low dose of ovary-stimulating hormones. IUI is more commonly done when the man has a low sperm count, decreased sperm motility, or when infertility does not have an identifiable cause. The procedure is also helpful for males suffering from severe erectile dysfunction. IVF, in vitro fertilization. IVF in action. Sperm are placed with unfertilized eggs in a petri dish. The aim is fertilization of the eggs. The embryo is then placed in the uterus to begin a pregnancy. Sometimes the embryo is frozen for future use, cryopreserved. Louis Joy Brown, born in England in 1978, was the world's first IVF baby. Before IVF is done, the female takes fertility drugs to encourage the ovaries to produce more eggs than normal. Time-lapse imaging triples the chances of having a baby for couples undergoing IVF treatment. Researchers reported in Reproductive Biomedicine Online May 2013 issue described as a major breakthrough. Time-lapse imaging became available in 2013 in the UK for monitoring the development of IVF embryos before they are implanted in the womb. In an abstract in the journal, the authors wrote, time-lapse imaging of human pre-implantation IVF embryos has enabled objective algorithms based on novel observations of development morphokinetics to be used for clinical selection of embryos. With this new technique, the scientists could develop a way of accurately identifying which embryos are more likely to have aneuploidy, abnormal chromosomes. Embryos with aneuploidy are much less likely to be successfully implanted. The researchers from Care Fertility said further large-scale studies are needed to confirm their findings. Researchers from Mount Sinai Hospital in Toronto, Canada reported in CMAJ that IVF is more successful if the woman has sufficient levels of vitamin D. A study published in the Journal of Clinical Endocrinology and Metabolism found that women who are deficient in vitamin D are half as likely to conceive using IVF compared with women without vitamin D deficiency. ICSI intracytoplasmic sperm injection. A single sperm is injected into an egg to achieve fertilization during an IVF procedure. The likelihood of fertilization improves significantly for men with low sperm concentrations. Donation of sperm or egg. If there is either no sperm or egg in one of the partners, it is possible to receive sperm or eggs from a donor. Fertility treatment with donor eggs is usually done using IVF in the UK and a growing number of countries. The egg donor can no longer remain anonymous. The offspring can legally trace his/her biological parent when reaching the age of 18.